objections in general. Something that I'm really proud of that we've worked on is building out a very robust training platform. And Jeffrey and Geo, as we call him internally here, is a big part of all of that. So when I talk about and when we talk about overcoming objections and why we are talking about this today, one of the biggest reasons is we have talked a lot about cross selling on multiple product lines, whether you're talking about Medicare Advantage with hospital indemnity. Oh, there we go. We sorted out tech difficulties. So Geo is here with us now. Oh, sounds like maybe audio's not working.
Can you hear
There
me?
we go. We got
Oh,
you now.
yeah, that's running into some tech issues there, unfortunately.
No worries at all. I was just wrapping up a little bit of housekeeping notes. We'll do some brief introductions here, and then honestly, we'll get started on
Sounds
this.
good.
I did have a couple questions. A couple people reached out via email and text and asked if this was going to be live. It is live. Bring your questions, bring your objections. Hear us yap for however long it takes us to get through everything that we've got today. My name is Will Pierce. For those of you that are not familiar with me or it's been a while since we've spoken, hi, great to see you again. These days I serve as our regional sales director here at Senior Marketing Specialist. So super excited. One of my biggest passions, and I think part of the reason why they asked me to be on this one is I love helping our agents not only get their clients better coverage and in a better spot than before they came to your office, but also helping our agents and agencies add more revenue to everything that they're doing as well. And cross selling kind of solves both of those issues. So, Gio, I will let you give a brief introduction.
Yeah, so I'll try to keep it pretty quick here. I've been in the industry now. I actually went back and calculated this. It's been almost 8 years, which it does not seem like that. Started off just as an agent, moved up, had some experience training classes of new agents, getting them used to the phones, working leads, all of that, going through objections, doing some ancillary trainings, and then after doing that for several years, moved over to this side of things. Still sell individually on my own time, but I mainly like to focus on doing technology training now here, and then again the ancillary training.
Yeah, absolutely. So, the way we've got today structured is we're going to go over three of what we hear are the most common client objections. And then we're actually going to take a little bit of time to dive into some objections that we get from agents over the years as far as cross selling. So, we're going to talk about the objection itself, talk about maybe some whys that objection comes up, and then Gio and I are going to kind of go through how we would think about tackling that objection and give some thoughts from there. Please do put your objections in the Q&A box. I will be monitoring it live. Would love to, if you have some that you've run across that you're not quite sure how to tackle, toss them in there and Gio and I can try to tackle them live and see if it's something that we might be able to help you out with. So I'm going to turn this into our first client objection here. And I think this is one that anyone who's tried to talk about an extra product always has heard at some point or other. And it's, yeah, I'm healthy. I really don't need that right now. Or I'm really not concerned about a cancer diagnosis happening because I'm really healthy. I feel great. I just had my annual physical and everything looks really good.
Yeah, I think it's interesting, an interesting objection because nobody plans to go to the hospital, right? It's always going to be one of those things where I think a lot of the time when I sit down and talk with clients and go through these objections, a lot of time when I get this "I'm healthy, I don't need this right now" response, usually I feel that it's something that maybe there's something that they don't understand. They don't understand how it works. And I say this because over the years of working leads, there have been multiple times where I've gotten calls from people, and they're unfortunately pretty sad calls with people that were recently diagnosed with cancer, and they're saying, "Hey, I was just diagnosed with cancer. I need a cancer insurance policy." So a lot of times, for whatever reason, when it comes to health insurance, there seems to be just this gap or this roadblock in the knowledge where people just think, "Oh, I'll get it when I need it." When
Mhm.
you compare it to the other type of insurance, if we're looking at PNC, like for example, vehicle coverage, You can't go back and get full coverage after you hit the deer.
Yep.
And that's the example that I always use, and I'll use that with clients. And I found that a lot of times when I've gone back and I've explained that, especially with these products now, because there's a lot of them that have guaranteed issue ranges, you can do the best job explaining that. But sometimes just that something goes off, and people said, "Oh, it's guaranteed. I can get whatever, whenever I want, so I'm
Yes.
good." I have found myself multiple times having to kind of walk that conversation back, even if I've explained it as detailed as I can, just because there's that roadblock there. And I'm like, hey, yes, while technically that's true, you're not going to be able to use that for the coverage that you're getting it for. That's not how the product works. There's the 6 month wait, and we go over the stipulations. And I've seen and heard that light bulb go off. Oh, I didn't realize that. Okay, well, explain this to me again. And then there's a little bit more of engagement in the conversation.
Yeah, I love the analogy that you had given when we talked. If you can't get full coverage after you hit the deer, you can't be there on the side of the road and be trying to call your insurance agent and get full comprehensive coverage on your auto policy as it's smoking and totaled after you just hit a buck on the side of the road or whatever happened. I always like to think of it as, and I know that first bullet point there kind of says it, but today's health is not tomorrow's. And I know that's really morbid to say it that way and really kind of sad to think about it in that light, but that's the reality of it. I can't tell you, I've had some personal family stories with cancer diagnoses, both on my side and on my wife's side. And it's one of those things where you feel great and then you go in for a regular checkup and you get the unfortunate news. And so I think there's a lot of ways to think about this. And the way that I like to approach it is that we're protecting you for the future, not just the right now. There's a statistic, and it's not recent, but there's a big uptick in cancer diagnoses above the age of 65. So if you have your consumers coming to you and they're almost turning 65, or maybe they just recently did, there's a really big uptick in the actual diagnosis rates once someone turns 65. Some of that could be just delayed care and they're just now, getting their screenings done or what have you. But there's a big uptick in that. And as we age, those risks can also go up for various issues. Or if you're talking about hospital indemnity, the likelihood that you have an inpatient hospital stay also tends to increase as we get older as well. And you guys know those policies usually have 6 month pre-existing condition clauses. If I knew what was going to happen to me 6 months in the future from now, I could do a lot of prep work today to make sure that I'm in a good spot then. But we don't know what that's going to be. I was talking to someone a while back about a cancer insurance policy for them, and you always get that, well, yeah, but I'm healthy, and so what if I go all this time and I never need it or I never use it? I've paid all this money for nothing. To that, I personally would say, well, listen, if you make it to age 90 and you've not had a cancer diagnosis, like statistically, you're very lucky. It's just shy of 50% of total people will have some sort of diagnosis at some point in their lifetime. So if you can make it to age 90, that's a really, really lucky and really blessed spot to be. And then secondarily, on the flip side, I really like running out the equation, especially for cancer insurance policies, of how much are they paying in annual premiums versus their benefit amount. And I'll give an example. If you're quoting a $10,000 benefit, and we'll just say the annual premium is $400, they would have to hold that policy and pay premiums for 25 years before they've broken even on premiums paid in to benefit amount. So if you've got a consumer that is sitting at your desk and they're 65 and you're quoting that policy out to them, you can tell them, okay, if you hit the age of 90, you're still kicking and you haven't had a cancer diagnosis, call me and we can cancel this policy. That's where the break even on those premium returns is. And I think that can be really helpful to think of it that way and put it kind of into people's minds of, oh, 25 years till I'm break even. So even on year 24, they would still be coming out a little bit ahead on that diagnosis payout.
I think, and this isn't one that we had discussed, but I know back in my final expense days, I would always get people that would have have the objection of, well, I could just put that money away and save it. So if you ever have any objection like that, my first question that I will always ask, I'm like, hey, that's a great idea in theory. How much do you have put away right now? It's always zero, because
Yep.
it's not done. Nobody's disciplined. I mean, people are not typically disciplined enough to do that. And I'm like, that's great in theory, but you've got nothing if something happens tomorrow.
Mm-hmm. Yeah. Absolutely. Gio, anything else you want to add on the I'm healthy, I don't need it objection?
I think just to kind of revisit what I was saying before, I mean, specifically with the GIs, I know we were talking about, hospital indemnity specifically is what that's in reference to.
Mhm.
Back when I first sold them, my objection handling with that was a little bit different because it wasn't GI, like it was fully underwritten at the time. So I had to kind of switch up how I work those objections, but just kind of keep that in mind. I think that that's a very frequent one that you'll get specifically with hospital indemnity, just because people hear I can get it whenever I want. I mean, I just did a presentation with a client of mine, and that's exactly what he said. Well, I don't need it now though, because I can get it whenever I want. Right? That's what you just said. And I'm like, let me go back and explain it again, and then that light bulb goes off. So just make sure that you're explaining that accurately and you're taking the time to explain what that guaranteed issue period is. In fact, if it would help you, have that excerpt pulled up from the application that says, hey, 6 months, this is how this works. And that can kind of help create that sense of urgency.
Yeah, absolutely. Next one comes up pretty regularly. I'd say is that's too expensive. I actually have talked about this with a couple of people. I think that's too expensive. In my experience, at least, I hear from agents that comes up when we're talking about cross selling for Medicare Advantage consumers, where I tend to kind of hear this come up quite a bit. And I think that happens a lot of times because we kind of get, or clients can get these zero premium blinders on. Once they hear I can get all this for zero, it can be really hard to go from 0 to 35 or whatever, hospital indemnity plan you're quoting. Getting over that zero can be difficult, and a lot of times people can struggle with feeling the value. I know, Gio, something you and I have talked a lot about is quoting those lower benefit amounts, and that something is better than nothing.
Yeah. Yeah, absolutely. I think the main way anybody that's starting in hospital indemnity, I always kind of label it, what I would call base level benefits, right? So when I think of a base level benefit, I'm thinking, okay, you know, $400 a day, 6 day for 6 days, matching that Advantage plan up, and then having ambulance coverage. Because a lot of times, if you have a senior that has a fall or has an accident, they need to go to the hospital. That's how they're getting there. Now on the flip side of that, if you have, this you've got an Advantage plan in your area, but it's like a $600 a night, premium, like obviously that, or not premium, but co-payment. Sometimes that can be, when you throw that in the quote engine, that's going to throw up a lot higher amount. So the way that I look at it in that sense is I like to kind of keep my initial quote around that $30 range, especially keeping in mind who I'm talking to, because it's going to change based on who you're talking to. You have to read the room. But the way I look at it is, if maybe somebody can't afford $500 a night for 6 days, but they can afford 400, right? Well, at the end of that week, right, instead of having $3,000 in co-payments, they have 600. So that's a huge help regardless. And that's another thing. And I'm jumping ahead a little bit here, but I get that objection from agents too, to where it's like, well, the plans change each year. It could be irrelevant because their copay could go up or down. I'm like, it's never going to be irrelevant, because if you do a $400 copay amount, whether that goes down or goes up, that's 400 that you're slashing off of their bill regardless. That's never going to be irrelevant.
Yeah. Yeah, absolutely. I really like, being able to provide a little bit of coverage rather than none. To Gio's point, if you're in a market that has either really high or rising inpatient copay costs on your MA plans, if it's 550 a day, but premium wise, they're comfortable at a $300 a day hit benefit, you've now taken their risk from 550 a day to 250 a day and covered 300 of it for them. That's still a better spot for the client to be in than nothing. And I think that's where this too expensive falls in a lot. Is a lot of times people feel like it has to be all or nothing. It's like, well, I didn't cover their entire inpatient stay. No, but you got them in a better spot than when they came into your office. And that's what we do is all about, is making sure that people leave appointments and leave our offices in a better spot than they walked in with. I put this quote up here on the first bullet point. This is, a way that I like to approach it, and the way that I've helped a lot of our agents approach it is that, from our conversation, from what we've talked about, it sounds like a fixed monthly expense is easier to plan for than an unknown hospital bill. Would you feel more comfortable if we could get that premium down to, and then insert a lower range here? If your initial quote was 50 a month, maybe say, would you feel more comfortable if we can get that down to $30 a month? I think that's one thing. The fill the gaps tools that a lot of our hospital indemnity carriers provide now, they're really helpful, but they build out really big hospital indemnity plans. They make them really benefit rich and
All
very
the bells and
expensive.
whistles.
It to Gio's point, yeah, all the things get added onto it, that if we can maybe dial that down or just have kind of a pre-built, hey, everybody gets this quote as a starting point, I want to leave you better than how you came in, you may find that the that's too expensive objection doesn't come up as often. Or honestly, and Gio, I'd be open to your thoughts here on this one, is sometimes that's too expensive means that they're not connecting the dots on the actual benefits itself.
Yeah, absolutely. A lot of times when I hear, oh, that's too expensive, I think, man, if $30 a month is too expensive, or $40 a month is too expensive, a $3,000 hospital bill is really going to be too expensive, right? And I like to break it down, kind of what you had explained earlier when you go through the cancer plan, like how you break even. I won't do it in that same concept, but I'll go through and I'm like, hey, essentially, if you go to the hospital one time, this pays for itself. For those of you who don't know, there's a case study that was done over the course of several years. The average hospital stay is actually 6 days, which is why the Advantage plans copays are for 6 days. So it just, you think of that and you put that in your mind. And you're like, okay, so if I write them this plan, okay, that's $3,000 that they're getting if you do 500 a day, and that's not even counting any of the other ancillary or riders potentially that you're looking at. I've one other one that sometimes I'll throw in there, or at least I'll talk about and mention when I'm doing the hospital plans, is outpatient. That can add a decent amount to that. I just like to explain that so people understand that the outpatient is separate from the
Mm-hmm.
inpatient. And I'll have some clients that opt to pay, that extra $10, $12 to get that, and some that it's not in their budget, and we just go with the base level plan.
Yep.
So again, it's just reading the room, talking with your clients. I mean, it really all depends on who you're talking to. If you have somebody that's going from a Medicare supplement to Advantage because of some of these rate increases, do that hospital indemnity plan that has all the bells and whistles, because that's
Mm-hmm.
going to get them as close to the supplement that they could get. And
Yep.
we have several agents here that have done that successfully. So I mean, it is possible, but you just have to read the room and match the right, benefit with the right client.
Yeah, and I think hospital indemnity aside, if we're looking at sitting down over the course, I always refer to summer as rate increase season for our med sub carriers. It just feels like we're always back to back to back on rate increases over the course of the summer. When you're sitting down with consumers and rewriting Medicare supplements for them, that's a great cross-sell opportunity into cancer or into dental or into whatever extra product you want to be bringing up, because you're saving them premium dollars already. If you can find a way to, within those premium savings, quote them a cancer product that still is saving them money over where they were prior with the rewrite on that med sup, that's a huge win. And if they were already paying, just can use some round math numbers here, $300 a month for their Medicare supplement, and you can get them down to $275 with a new med sup and a cancer plan, you're saving them $25 a month and getting them an additional product as well at the same time. So, when people are saying, well, my med sub's getting really, really expensive, I would love to be able to get down on premium, and you're doing that rewrite, that can also be a really easy time to say, hey, would love to talk to you about some extra products right now, and still, hopefully have you out here saving money on your entire total premium package as well. So there's a lot of ways to approach that's too expensive, but I really like the something is better than nothing, and making sure that they're walking out that door with better coverage than they walked in with.
And you can hear, if you quote something too high, you can hear the hesitancy in someone's voice to where they're like,
Mm-hmm.
oh, I can try to make it work. You
Yeah.
never want to push that on somebody, because what's going to end up happening is that policy is going to be canceled. I'd see that with
Yep.
life insurance all the time. And I'd say, hey, I know this is the amount that you wanted. Let's get it to something affordable so we know, you can hang on to it this time.
Yep. Absolutely.
And one other thing I wanted to say too, Will, to add what you said, when you're bringing it up to existing clients, one of the objections or one of the pushbacks I've got against that is, well, I didn't offer it to him before, so how do I offer it to him now? And there's a lot of different ways that you can go about that. I mean, I've worked with agents that are like, hey, this is a product that we're offering now, specifically home healthcare, because we're getting this request a lot. We're seeing a lot of claims on home healthcare. We're seeing how limited it is with Medicare. So this is something we're bringing back up into appointments. Again, multiple agents I've worked with that have done that. Talking, not to get too much into the specifics of the reimbursements and all that, but there's a lot of benefits to that plan, to where it's like, hey, I'm excited to tell you about something else that we're working with because we've seen a need for it in the community, or because
Yeah.
we've decided to take this on. There's a lot of different ways that you could approach it.
Absolutely. Gio, we've got a question in the chat that I'm going to toss to you. On that study that you referenced, is the 6 days the average hospital stay just for seniors, or is that just the general population on that
I
study?
believe it wasn't specific just to seniors. It was just viewing the population just across the board.
I think that's a great reminder too. That yeah, I know a lot of our agents are also in the under 65 ACA and group
Mhm.
space. These policies a lot of times can fit needs there as well. You know, it's no secret what happened in the ACA market this past year with the subsidies and more people going bronze than ever before. But that's for a separate conversation. Those consumers need, you know, these hospital indemnity and cancer products just as much as our senior population does as well.
You know, it's interesting, even some group coverage as well, when you look at that have high copays. Like years ago, I got a lead that wasn't the right person, but we hit it off, and that's exactly what we did. We talked about a hospital indemnity plan, and that's what she did. She's like, "Oh, that would help." And she
Yep.
worked at the hospital and had insurance that was, so I mean,
Yep.
again, it really is for, I think the lowest that some of these cares go down issue age wise is 18. So I mean, you've
Yep.
got a wide range of people that you can write.
Yeah. Yeah, absolutely. This is the objection that I always feel. You've done the whole presentation, you're at a premium amount that they've told you they're comfortable with, and you're right there, and then they say, let me think about it. Or let me talk to my husband, my wife, my daughter, whomever their decision maker helper is. And they say, yeah, I don't know, just let me think about it.
Yeah, I think a lot of times when that question comes up, at least in my experience, I like to ask, okay, like I'm thinking to myself, what did I not explain well enough? That's the first thing that I'll think of. So I'm trying to go back through and to reference even a little bit about what we had said earlier, like the whole deer in the headlights reference. I will find a lot of times that's why. And I've gotten that question where like, well, you said earlier that I could get it whenever I want. So I don't understand why I would get that. I'm like, oh, okay, I understand. Well, let me explain that again. And then we'll go through it. So that's happened, I think, a lot more recently, just because like it didn't used to be GI. So it's just a whole different way of having to handle those
Yep.
objections. And then asking too, what questions, do you have? What can I answer for you? What do you have to think about essentially? Like I've asked
Mhm.
that multiple times. I'll just be blunt about it. I'm like, okay, so what do you have to think about? What are you concerned about? What
Yep.
questions do you have for me?
Yep. Yeah, it's it's not a one to one, and it's not batting 1,000 to use a baseball term. But I think the vast majority of the time that this objection comes up, there's some piece of the presentation or the information that just did not quite click for them. Maybe it's the process from being in the hospital to getting the benefit paid out that's not clicking, that they're thinking could be difficult to use, or sounds great on paper, but I don't think it's actually usable thought process. Or maybe they said they were comfortable at 40 a month, but maybe 30 is actually the magic number
Mhm.
to get them to opt into this coverage. And so I usually feel like this one is there's something that's just not quite connecting the dots. If they say, nope, I completely understand everything, I just genuinely need to sleep on it, I don't make any decisions without sleeping on it, my biggest advice would be to tell them the day and time that you're going to call them back. Treat it like a scheduled appointment. Too many people that I talk to say, "Okay, yep, sounds good. I'll touch base with you in a couple of days," and they leave it really open ended. And I think that doesn't set enough, urgency and importance into this conversation. If someone seems interested and they say, "Yep, let me think about it," say, "Okay, I totally understand you want to take a day or two to sleep on it. If you feel like I've answered all of your questions, I'm going to call you back Tuesday at 10 a.m. on this phone number here. Does that day and time work for you?" And just really treat it like it's another scheduled appointment with them. Because if they think that you are viewing it as critical and as important to them as it actually is, if they're getting that same sense and that same feeling, it can sometimes help kind of push that over the last little, objection hump on it. But I'm a big believer that this one means we just didn't quite make all the information click more times than not.
I think to add on to the last point too about if somebody genuinely wants to think about it, there are times where that does happen. It's not all the time, but there's some times where it's significant and you can tell. You don't want to push too much when that comes up, because sometimes
Yep.
it's maybe they have a family member that helps them make their decisions.
Yeah.
I think to echo what Will said there, yes, have a concrete date and time that you're calling back. Do not have it set to where, hey, you just reach back out to me when you want. Spoiler alert, they're not going to reach back out to you
No.
99% of the time. If you just have it wishy-washy where you're going to call them back whenever, you'll forget about it, or maybe you'll do it, too late. You're not going to, it just doesn't work. Have that concrete date and time set, because it shows that it's important. The other
Yep.
thing that I will say to this, especially if you're doing stuff over the phone, which is what I primarily do, um, send them information. Like, I will send that whole brochure so they can see everything outlined that we've discussed. And some of these people, for me, I've gotten referrals, but I haven't met them in person yet, or I haven't shake their hand. I haven't looked in their eyes.
Yep.
So it just shows me like, hey, this is exactly what we're talking about. Here's what we did do today. Here's what we discussed. Here's this full brochure. Let me know if you have any questions. A
Yep.
lot of times when I've called back, or we have that scheduled appointment, sometimes I'll get a call back before them, because they just see that and it puts them at ease. They're like, oh, I can see everything. It's there.
Yep. I would say too, Gio, you brought up the great point of, if they do genuinely have someone that helps them make their decisions for them, offer a second in-office appointment and let them bring that
Yep.
person with them. And I say that not only just to overcome the let me think about it objection and to hopefully end up closing them into a client, but maybe you can also enroll their decision maker. If it's, mom or dad helping make decisions for grandma and grandpa, and they're in their mid 50s, for example, they may not be Medicare clients for you, but you can probably solve a need for them as well. They may still need a cancer plan themselves. They may still need a hospital indemnity plan themselves. So, through overcoming this objection and helping them bring their decision maker into the office, you may also gain additional clients and additional referrals from that as well.
That, and if you think of it from the aspect too, if they do have somebody that they go to help make their decisions, like if they're going to a child, the way that they're going to present this to a child is not going to be the way that you're going to present it. The
Yep.
value and the need is not going to be there. All that child is going to hear is, oh, this guy's trying to sell my mom another $40 policy. She doesn't need
Yep.
that. When in reality, if I'm able to talk with that, I can say, hey, here's what your mom's policy looks like. These are what those co-payments could be. This is
Yep.
what I recommend and what I do for my clients to put some protection into place. It's going to be an entirely different presentation where I can answer questions. Whereas it's not going to come off that way if it's just them trying to convince a loved one.
No, you're absolutely right. That importance and the gaps in their current plan are not going to quite make it through the game of telephone. I think anyone who's played a game of telephone or anything in their life knows that the message always gets lost somewhere along the way in translation. So you can
Yeah.
really, talk to the decision maker about the importance of this policy and make sure that they see the value in it. Because if they're in charge of grandma or grandpa's checkbook, if they don't see the value in it, they're not going to say no on that. All right. I'm going to turn into some agent objections. And what
This
I
is the
mean,
fun.
this is the fun one. What I mean by agent objections is when we talk to our agents and start asking them questions of, hey, you're writing a lot of Medicare Advantage. I'm really not seeing much hospital indemnity or much cancer come through, or I'm not seeing any cancer insurance come through on your, MedSup applications that we're writing, or it's really, really low attachment rates. These are always kind of some of the things that we get back from our agents. So, Gio, which one do you want to start with?
I want to start with the too salesy one, because that's
Okay.
the one that I think, for me, I hear about all the time in different trainings, and when I talk with agents and they're wanting to get better with ancillaries products, I've heard that in group settings,
Yep.
individual settings, because nobody wants to come off that way,
You don't want to be a used car salesman.
Exactly. Beat me to it. Yeah. I was just saying, you don't want to get everything set up and then have all this stuff thrown at you at the end. So
Yeah.
if you're worried about being salesy, the biggest thing that you need to work on is integration. So when you're like, for example, I'll use hospital indemnity because that's the main one that I started with when I first jumped into the ancillary world. If you're pitching an entire Medicare Advantage plan and they're about to get off the phone, you've done the enrollment, you said, hey, I need to talk with you about this. That's not going to work most of the time. You may get lucky every now and then, but that's a very poor way of doing it, because it's the whole, but wait, there's more. Let me just say something at the end. If you integrate that into your process, and when you're in the middle of going through the Advantage plan and you're talking about that max out of pocket and you're talking about how high those hospital
Yep.
copays are, and you're outlining that. So yeah, essentially, if you're in the hospital for 6 days, that's 3,000. Your max out of pocket is 6,700, and you're talking about it that way. Then you insert the line however you want to do it. We have a hospital plan that we put into place to help take care of this. That's what I do for my clients. We'll come back to this. I want to focus on this first, but I just wanted to make sure. I know those amounts are kind of high, but we've got something
Yep.
that can take care of that for you. And
Yep.
then I'll keep moving forward. It's important to not completely shift gears, because I've gotten clients that were really excited and wanted to jump right into it. It's okay to ask a couple questions, but maintain control of that conversation. And I've had to pull people back a few times and say, hey, I promise we'll go through all that. Let's make sure we get this taken care of first, especially since it was a last enrollment December 7th. I'm like, let's get
Yep.
this one first, and then we'll talk about this.
Yeah.
What that allows you to do is when you finish doing that enrollment in the Advantage plan, you can naturally come back to it and say, hey, now we talked about this earlier. Let me go through this. And it's not this unexpected, always trying to sell me something. It's like, oh yeah, I remember
Yep.
we talked about this earlier.
Yep.
Sometimes you'll have calls where you can dive right into it if it's a short, quick call.
Yeah.
Sometimes if it was a longer call, maybe you had a lot of medications or it was somebody making a big switch, it's okay to have the follow-up. Again, as long as your follow-up is concrete and to the point to where you're saying, hey, it's going to be this date at this time, I'm going to call you.
Yeah.
But that works great to do it that way. And it's hard because if you have a certain way that you've been presenting, you really
Yep.
almost have to dial that back and create it. It doesn't happen overnight. It's a process, but I can promise you it will help you be effective and not feel salesy at all. Because I never feel salesy when I talk about it.
Yep. I think, the feeling too salesy and that being a concern, I think is valid. We never want to feel like, a sleazy used car salesman on the lot just trying to rack up commissions. I
Mhm.
think, I would kind of combat this with a question back to any agent is, do you genuinely feel and believe that Medicare has gaps in its coverage, whether we're talking about original Medicare and a Med Sup or Medicare Advantage plan? If the answer is yes, then it should be our job and our due diligence to fill those gaps or at least make the clients aware that these gaps exist. Making them aware that the gap exists, in my opinion, is not being salesy. I think being salesy is in your presentation. If you're pushy and, an objection and a no are two very different things. If you're, not respecting their no, that's when it can start to be salesy. But if all you're doing is when you're, going through that Medicare Advantage plan presentation, for example, and you say, your inpatient per day is $500 a day. If you were to be in there for 3 days, that's a $1,500 bill. Do you have a plan to pay for that? Yeah, but I really don't want to have to pull the money out of my savings. Okay, remind me when we get to the end, we can talk about a way to cover this for you that wouldn't require you to pull that money out of your savings. You've brought up the need for hospital indemnity and you've said, hey, remind me, we're going to talk about this at the very end. That wasn't salesy at all. You're just asking them, hey, do you have a plan to pay for this if it happens? If it's your original Medicare and a Med Sup consumer, if you were to be faced with a cancer diagnosis, and if you're in a rural area, where do you plan to receive your care? Well, I'd probably have to drive a couple hours to XYZ hospital. I know they're supposed to be really, really good at it. Have you thought about how much those hotel stays or the Airbnb could cost? Your Med Sup is going to do a really good job on a lot of your medical costs, but a lot of cancer is non-medical. Do you have or have you thought about how you'd pay for non-medical diagnosis expenses? Because that's where there's a huge need for our Med Sup consumers on cancer plans is non-medical expenses. I've got a great story from one of our agents of their dad going through a diagnosis and having to be at an Airbnb for months in isolation because of the type of treatment that they were receiving. Nobody wants to have to plan for that, but Airbnbs and hotels are not cheap if you're there for 3, 4 weeks at a time receiving treatment. So there's a lot of ways to bring up the gaps. I'm a big believer, and I genuinely will stand on the hill that original Medicare and MA plans have gaps, and they need to be filled with these necessary products. I am going to move on to one that I always am really intrigued by, is my clients are on a fixed income. And
Mm.
I'm jumping down to this one because it's something that I talk about a lot is, and my grandparents beat it into my head from a young age is one, to not make any assumptions about someone's life and about someone's situation. I've heard stories from annuity agents that they've written some of their biggest annuity cases in trailers with holes in the walls. But if you would have made an assumption, you never would have made an ask about those extra products. But the saying that I was always told growing up is don't write the check that you're not cashing, meaning don't make an assumption about what someone's checkbook or what their pocketbook looks like. Yes, many seniors are on a fixed income. To that, I would also say a fixed expense is easier to plan for on a fixed income than an unknown expense. Gio, any thoughts on that one?
Well, I was going to say you read my mind because that's the next one I wanted to jump to too, because that's a conversation I have a lot of. My clients are on a fixed income. In my mind, just like you just said, when I hear that, I'm like, that should have the opposite effect. Your clients being on a fixed income is why you should be presenting this plan, because a fixed income, it's a lot easier to pay $30 monthly or $40 monthly than, oh, I was just in the hospital for a week. Here's a bill for $3,000.
Yep.
That could happen multiple times through the year. Here you hit your max out of pocket. So
Yep.
I think it should really have the opposite effect. I also think, to your point where you're like, don't write the checks that you don't cash. Like, let the clients decide what they want to do. Like, I have received multiple referrals where my referral was, the way it was outlined to me, it's like, hey, they're low income, they can't afford much, they want a Medicare Advantage plan. I've had referrals like that have actually wanted a supplement when we broke stuff down. I've had referrals on the Advantage plan that we talked about ancillaries, and they have taken out hospital indemnity or a cancer plan because cancer runs in their family, depending on wherever that conversation went. I don't think that's just one to me that's personal. And do I share my fatal mistake that I made? Will, I don't know if I
Yes.
want to do that or not.
Go for it.
When I was very green, this is when I first started selling hospital indemnity plans. I had a client on the phone, and I was really excited because I started feeling confident. I taught myself about the product. He was on Medicaid. Didn't click at the time when I'm talking to him. So we go through it. I pitched this to him, and I'm like, hey, this will basically give you extra money, to offset anything that you're doing outside. Like if you're working or doing anything, this is just going to be cash that goes into your pocket. He was on the highest level of Medicaid. Get off the phone with him, and I realized, I'm like, oh, you know what? That doesn't work. Because it was like the first couple of weeks I was doing that. So I go in and talk with my sales manager at the time. I called the individual back and I said, hey, I've got good news and bad news. You have the highest level of Medicaid, so you're still not going to have to pay, for copays when you're going in there. However, here's why this wouldn't work for you, because I wouldn't want this to affect the income and affect your benefits. He's like, oh no. And I was like, yeah, it's very nice about it. And we moved on, and like, again, not a big issue. It's always embarrassing for me to share that, but I like to share that story because if you're worried about clients being on a fixed income, I've had a client that was on the highest level of Medicaid, and he saw the value in it based on how we talked about it in the presentation.
Yep.
So let the clients decide what they want
Yeah.
to spend their money on and what they feel is valuable.
Yep.
Again, I think a lot of this, when you're going through this, if you truly have it integrated, you're stating the problem and then you're stating the solution immediately after.
Yep. Yeah, absolutely. I'm going to jump over to the next one, which I get, pretty regularly, is the I'm too busy one. My appointments are already jam-packed and I'm too busy and I don't want to overwhelm the client. I think a lot of times can kind of go hand in hand here, but it's, we just did a full hour Medicare 101 presentation and their brains are about to explode from all the Medicare knowledge I've dumped on them. I just really don't have time on this. And to that, I would say, okay, I hear you. If we don't have time where we can work it into the initial appointment with them, once that MA plan is issued and they've gotten ID cards in the mail, or they're about to do it in a follow-up conversation. If if you're doing the presentation, as long as you're covering all the benefits as you compliantly should be on an MA, you're talking about those inpatient per days. You're talking about the ambulance costs. You're talking about, if it's a med sup presentation, what Medicare does and doesn't cover, that you should still have something tangible to follow up with them on. Is, hey, hey, Mr. Client, I saw your policy got issued. Next steps is, are you going to get an ID card in the mail in 7 to 14 business days? If you're paying a premium, it'll draft on XYZ date as we had entered it. By the way, do you remember when we were going through our presentation and we talked about your inpatient hospital stay on your Medicare Advantage plan, or what Medicare does and doesn't cover? As long as they say yes, I remember talking about that. That follow-up conversation can be a great time to do it. On the flip side, I hear this one a lot during AEP and during Q4. I don't have time during my AEP reviews to sell HIP and do an MA review and a rewrite. Totally get it. There's only so many hours in the day. AEP is a madhouse and is going to be again this year. Do it during OEP and during fourth quarter, or during first quarter, is when you're doing those follow-ups and you're doing the checks to make sure, okay, yep, everything went through, that policy did get issued, they do have their coverage. Do it on those follow-up conversations. There's nothing that says that we can't call them a second time and then cross-sell them the hospital indemnity plan.
Well, and to echo to that point, there was an agent that I worked with years ago, and that's exactly, he did a variation of exactly what you just said. When he was talking with clients during AEP, he had planted that seed and notated clients that were like, hey, this would be a good fit for hospital indemnity. I need to call them back.
Yep.
As soon as AEP ended December 8th, and there's nothing going on, his hospital indemnity sales skyrocketed because he was
Yep.
calling all these clients back and they were expecting that. And he
Yep.
got that just like that plan was set for that following calendar year. That's when he was setting that hospital indemnity up.
Yep.
So, I mean, again, if I think, and really when it comes to time and stuff, I know these appointments can get booked up. When you're doing this hospital indemnity plan, if you've ever gone through the application process, it's very simple and quick, especially, I mean, you have to think of it. There's no underwriting with these wide guarantee issue ranges too. So you're not asking a lot of questions.
Yep.
But again, if that's a concern, do that strategy. Put like, even
Mhm.
whatever, if you're using Integrity Connect, do a tag for a hospital indemnity candidate, and you can do a
Yep.
campaign, and you can even go the email route, do an email campaign, do a physical, campaign. I know we've got hospital indemnity flyers that we have here that
Yep.
you all can utilize. There's a lot of different ways that you could go about it.
Yeah, absolutely. I'm going to move into our last two that I think are a little bit more vague and a little bit more broad,
Mhm.
but I think do come up, in conversations that I have quite a bit. And that's either the fear of the yes, and I know that sounds really goofy to say, or over preparedness as an objection. And I'll kind of set the stage of what I mean by those two, and then we'll talk about these ones as our last ones. But when I get the over preparedness one, it's that we don't feel like we can talk about a plan until we know every single in and out of it. I need to know every piece of nitty gritty detail of this plan before I can even talk about it to a consumer. Because in the back of our mind, what if they ask us a question that I don't have the answer to? And there's something we talk about internally a lot to our sales team. If an agent asks you a question that you don't know the answer to, the best thing you can say is, hey, that's a great question. I don't definitively know. Let me do a little bit of research and call you back. That comes across a lot better to a client than, well, I think you want to have a sense of confidence in there, but we don't, to even talk about how a hospital indemnity plan can benefit a consumer, we don't have to know every inch of the policy benefit guide and every inch of the summary of benefits and every inch of the evidence of coverage. We can still do a quality and compliant presentation without overburdening ourselves with knowledge.
And I think too, when you talk about, getting like having a fear of being asked something that you don't know. I've been asked many questions that I have not known over the years in this business because things have constantly changed.
Yeah.
Every time I've responded to the question, I'm like, hey, that's a great question. I'm not 100% sure on that. Let me look into that, and I can get back with you on that. Get everything set up properly, however you need to. Every time I've done that, the majority of the time that I've done that with clients, I've said, hey, I appreciate you double checking just to make sure everything's right. And I said,
Yep.
absolutely. It's better to check now than to be unsure. I mean, I get positive feedback when I have
Mhm.
that type of response to somebody.
Yep.
The other thing I will say, as far as to add to the objection handling and just the objections in general overall, if you wait till you're, oh, I'm 100% confident I can handle any objections, you'll never bring it up.
Yep.
Think of when you started selling Advantage. Think of when you started selling Supplement. Think of when you started selling any insurance product. I can
Mhm.
remember my first supplement sale today. It's almost 8 years ago now. I was so nervous. I was like, I don't even know where to send the signature. I didn't, and it was one of the easiest portals, at the time. But it's just one of those things. You will learn through trial and error and through doing this. Once you start integrating this into the presentation, you're going to find out personally what works best with your style. You're going to figure out what are some really great objection handling techniques, and you're going to find out some things that maybe aren't so great. But you learn along the way, and that's how you get better.
Yep. Yeah, absolutely. Couldn't agree more. Guys, please feel free to toss your questions in if you've gotten something that has maybe thrown you for a loop that you're not 100% sure of. But I think at the end of the day, with when it comes to objections, is one, I hope you're getting them. If you're getting them, that means we're talking about these products. If we're not getting objections, either we're batting 1,000, in which case I would love to know how you're batting 1,000 because I don't know
Me
anybody that
too.
bats a
Yeah.
thousand. So either we're batting 1,000 or we're just not talking about them enough. And I think they're not talking about it enough usually comes from the sense of feeling like we have to be overly prepared for anything and everything that could come up, or making too many assumptions about our consumers when they're coming to us. I think a really soft way to start bringing it up more is to be using a client intake form or a fact finder. We've got a great one on our website if you've never taken a look at it, but it makes you go through every single necessary additional product of, do you have cancer insurance in place? Do you have a hospital plan in place? It forces agents to ask on that intake about these extra products that can make them bring it up during the appointment even easier. As a reminder of all the places to find us, our 800-689-2800. If you need to call us, you can live chat us from smsteam.net. We've got a little chat bubble in the bottom. Those are real people. They are not AI bots. I want to be especially clear of that these days when a lot of places are using AI chat responders. Those are real people. You can find a lot of our training content on our university. And of course, you can always catch on our YouTube. But we do not have any additional questions in the question box, Gio. So I want to thank you for your time. I really enjoyed this webinar today.
Absolutely.
All right. Everyone, catch us on the recording, and we'll talk to all of you guys soon.